everyone, my name is Dimitry. I'm a health policy associate with Texans Care for Children. At Texans Care for Children, I work on coverage issues as well as infant and maternal health, but a big portion of the work that I do is with obesity prevention and reducing food insecurity, because those are two major drivers of poor health outcomes in our state. This session we were able to make some really great strides with reducing food insecurity, increasing breakfast in Texas schools. We were able to increase fitness in Texas schools, do some important work around fitnessgram testing, and also improve the nutrition of youth who are aging out of the foster care system. SB 376, which passed this session, is a bill that will go great strides to reducing food insecurity in Texas. The bill will increase the number of children who live in low-income school districts who receive a nutritious breakfast before school starts. And this is not only a good hunger reduction policy, it's also a good education policy. We know from research that students who are full and have had a nutritious meal are better able to learn and pay attention in the classroom. So Fitnessgram is an annual assessment that's conducted in Texas schools for children who are in PE. And what it does is it gives the students a sense of where they are, their cardiovascular health, as well as their muscular health, as well as some other health indicators. It also informs parents about the health of their child. It helps PE teachers know if their programming is effective. It helps school districts know the same thing. This session, unfortunately, not unlike the 82nd legislative session, we saw some attempts to completely repeal and or cut back the Fitnessgram test. At Texans Care for Children, we worked with our partners in the provider world as well as the education world to really work on educating lawmakers about the importance of this test and that it should stay intact. And although several bills were filed that would have eliminated or reduced Fitnessgram, we're happy to report that none of those passed this session. This session, we were able to get a $5 million rider in the budget for Fitnessgram testing. The money will be able to go to the Texas Education Agency, TEA, in order for them to make better use of the Fitnessgram data that they receive from Texas schools. And the money will also be used for smaller school districts to help increase their capacity to do the Fitnessgram testing. House Bill 1018, which passed this session, will help improve the fitness in Texas schools by asking school health advisory councils, or SHACs, which are parent and community organizations or advisory councils in schools, to look at ways in their across the district and in campuses for increasing fitness within the school day, and then making recommendations on how to do that. It also encourages community partnerships for this purpose. HB 2111, which passed this session, will help improve the nutrition of youth who are aging out of the foster care system by adding nutrition education and hands-on cooking preparation to the life skills training that they are required to receive. Oftentimes, youth who are transitioning out of foster care lack access to opportunities to learn how to cook and to get good, important nutrition education. We're sad to report that a bill that passed HB 217 this session was vetoed by the governor. The bill passed with bipartisan support and would have reduced sugary drinks in Texas middle schools and junior high. This has been a major priority. Sugary drink reduction has been a major priority of Texans Care for Children. We have a campaign, our Drink Well Texas campaign, because as we work on obesity prevention, we know that sugary drinks are a major contributor to the problem. Research tells us that about a third of Texas kids drink 3 or more sugary drinks per day. And if you do the math on this, this is about a 2-pound bag of sugar every single week. We know that if we want to have an impact on the childhood obesity epidemic in Texas, we have to get sugary drink consumption down. So while HB 217 didn't pass this session, this is an issue that Texans Care for Children will continue to work with our partners on. For all the people who took time this session to advocate, to make calls, to email, I want to give you a personal thank you and tell you that you make our jobs possible. When we go to the legislature, we tell them that people care about our issues, that people care about the health of Texas children. And when you make those calls and you let them know that that you care, that you personally care, that makes a huge difference. It lets them know that we represent real people.